Okay, so today I've been asked to share with you a little bit of how we teach what's called the clinical integration class. In clinical integration, that is a focus on the orthopedic assessment component, trying to figure out what's wrong with our client so we can build a treatment protocol. So an example would be the client's going to come to my clinic or my setting where I'm working, and as they come in, I have to start working with them. So the first thing I want to do is I want to take a look at when they first come in the door, how do they present? Do they have a facial expression of pain? Are they holding their head in certain positions? Do they seem to be compensating in one way, shape, or form? And as they do that, each position that they present with, each thing they tell me, even the way they point, gives me indications as to what might be a problem with them. So I do that. We give them the paperwork. I review the paperwork to see what they've written down. But then I bring them back. I would have obviously taken a look at their posture, possibly their gait or walking style. And then I bring them in and I start with what's known as the interview process to try and figure out what's going on. And then from there I'll build on that and I'll take them through a physical assessment. So in class today we were trying to do what's called differential diagnosis. And in that particular case, even though I should say differential assessment. And what I'm trying to do is trying to rule in or rule out certain possibilities as the source of their pain. So in this particular case, I asked the students to do what's known as an active range of motion. This is referred to as lateral flexion to the left. This is referred to as lateral flexion to the right. When the client does all the motion, it's referred to as active range of motion because the client is actively doing the motion. If it was passive range of motion, that would mean the client would completely relax and the therapist would do all the moving. And then resisted testing would be when the client is asked to really use their muscles hard against a resistance so I can test the strength and durability of their muscles. Well, in this particular case, the example we gave is the client comes in and I've asked the student. The client goes like this and just lets their head drop to the left. The student should then be asking, okay, client, does that hurt? Client will say no. But then we ask the client, now when does it hurt? And the client goes, when I do this, now it hurt. So the next thing we have to make sure that the student knows to do is ask the client, where does it actually hurt? Because otherwise the chances are good that the students are going to make an assumption that it hurt on this side. So as the student asked, the client answers with, it hurt here and it hurt here. Now because the client said there's two different locations of pain, the student has to start thinking about two different possibilities. So then we asked, what was different about this position versus this? And the difference was, in the first one, there's really no act of contraction where there's force needed. It's just a very light movement. But now these muscles are forced to contract very hard, and this side of the neck is now stretching out. We also teach the students to be very detailed in their questions, but also in interpreting client body language. When the client said, when I do this, and used one finger and pointed right here, the chances are extremely good that the problem is right where they pointed. If the client then took their other hand and did this and moved down the side of the neck, but they didn't point to one spot, that typically tells me that this side of the neck is trying to stretch. It's not stretching properly or efficiently, and that's creating the pain on this side. So we need the students to recognize those different types of situations and interpret the motion of the client to figure out, now, if this is the side that's hurting and it's during a contraction of a muscle, then I want to go in and start poking, or technically the term is palpating, those particular muscles to see if they could be the source of the client's pain. I also want to come to this side of the neck and I want to start palpating and assessing and watching the way they move, because if a muscle is shorter than it should be, tighter than it should be, it's going to have a very difficult time stretching appropriately. Muscles that stretch, ligaments that are lengthened, should not be painful. And in this particular case, right here is a normal stretch, But as I force it down, this side is being asked to stretch farther, and it becomes painful when it shouldn't. It's a problem. Then the students would move into what's called CMT 1, 2, 3, or 4, and at that point in the program, they're taught the individual techniques needed to address each of these soft tissue problems.